Hello, and welcome to Prairie Pulse. Joining us on today's show is Dr. Avish Nagpal, the infectious disease specialist at Sanford Medical. And Dr. Nagpal, thanks for joining us today.
Thank you, John. Thank you for inviting me.
As we get started, tell the folks a little bit about yourself and your background.
Sure, absolutely. I did my medical school training in India, and then I moved over here for higher studies. I did my master's in public health in Bowling Green, Kentucky, and then I pursued a residency here in internal medicine when Sanford was Meritcare between 2007 to 2010. Then I went away for a little bit to pursue an infectious disease fellowship in Rochester, Minnesota through 2013. And since that time, I've been back here working in the Department of Infectious Diseases. And over the last 4 years, I've been the medical director for infection prevention program at our institution.
Now, at Sanford, are you the only infectious disease specialist, or are there more?
There are more. We are a small department of 5 people, and we have our own small areas where we do further work. So my area is infection prevention, where I'm the medical director.
Dr. Nagpal, obviously in May we had you on the show by Zoom. We had to do it electronically, and here we're in a different situation in the studio, trying to at least physical distance. And you know, we didn't think we'd be back here in the fall talking about this at the time. But you know, can you talk a little bit? You know, although the death rates have dropped somewhat, in your estimation, sort of where do things stand right now?
Yeah, so what we are seeing right now is a true community spread throughout the country. In May, when we talked, we were essentially still in late stages of lockdown, where most of the businesses were still either closed or partially open. All the schools were closed. And now we are at a point where most of the businesses are at least partially open. The schools are back, the colleges are back, and there is more travel around the country and internationally. So with less restrictions in place, there is more widespread community transmissions. Earlier, when we had last talked, I think we were seeing most cases in Cass County than anywhere else. And now if you look at our numbers here in North Dakota, we are seeing COVID transmission pretty much throughout the state.
Yeah, you know, again, in February, March, early on, you know, we said we need a few weeks. And of course, now North Dakota has seen a per capita increase in cases. Why is that?
So with everything, there's more than one reason for everything that happens. I think the primary reason is that more businesses are open, more people are back in the workforce, more schools and colleges are open, and there are less travel restrictions. And add to that we have increased our testing capacity quite a bit from where we were in March, April, and May. So we are detecting a lot more cases now as compared to what we were detecting in March, April, and May. So I think all those factors contribute to increase in cases.
Yeah, and what about the deaths in North Dakota? Early on, you know, they were low. They seem to have risen, maybe per capita. Again, is a lot of this sort of the unknown of the virus early on, and of course now it's just following the path of the rest of the United States?
So I think we know a lot more about the virus now, but there are obviously some unknowns. We know who's at the highest risk of complications like respiratory failure or death. I think if you look at the graph overall in the country and even in North Dakota, we had a peak where we were having more cases in metro areas, and at that time we didn't have too many treatment options that we knew worked partially or well. And now what we are seeing is we are trying to manage hospital capacity, but the cases are increasing. So you know, we are having more people in the hospital, but now we have treatments that either lead to you know, earlier improvement or decreased mortality. So that's a difference. So earlier the mortality was because all of the cases were rising very rapidly and we didn't have too many treatments and hospitals were getting overwhelmed. And now we are just seeing more deaths because we just have more number of cases, which translates into more number of complications and more number of deaths. So those are the difference between the two peaks that we are referring to here.
You know, in North Dakota, here you're talking about cases in rural counties. Of course, they were very low, and then Fargo was up, Bismarck was up. You know, what was sort of the difference in the different rates at different times, and did it have to do with wearing masks or other things, or any number of things?
A number of things. Again, most things, as I said earlier, have more than one reason behind them. The earlier, when you were seeing case numbers explode in Fargo, I think those were primarily attributable to infections in our vulnerable population, be it at a nursing home or homeless shelters, things like that. And now with more businesses open and schools open, colleges open, you are seeing more cases in younger individuals. If you look at the breakdown of who has had most infections here in North Dakota, you'll see that people between the ages of 20 and 40 have the most infections. So that's what you are typically seeing in Bismarck. We have done a pretty good job, I think, with our nursing homes, where we have done weekly testing on people residing in nursing homes, people working there. So we have managed to protect those vulnerable populations. But as we open more businesses, as more people are out in the community, we will see case numbers rise. That's not a surprise. So that's the difference between what we saw in different metro areas. And again, with less restrictions, more workplaces opening up, more businesses opening up, it's not a surprise that we are seeing more widespread transmission in communities all over the state, including rural counties.
Hey, let's talk about a vaccine for a moment. It's in the news a lot. You've heard some people say we'll have a vaccine in a few weeks or a few months, or by the first of the year, or it'll be 18 months. So, what are you hearing? What are your opinions about a vaccine?
Yeah, so I think vaccine is very important for control of this pandemic. I think that's a tool that we are really missing in our arsenal right now. We have some treatments, we know what preventive measures work, we have a good test, but really what we do need is a vaccine. We cannot wait for the entire population to reach a level of what we call as herd immunity that will lead to a lot of deaths, and we will continue to be in this partial opening closure phase for a long time. So I think in order to return to some semblance of normalcy here, vaccine is very important. And I've been very impressed with the pace and cooperation internationally around vaccine development between different countries, different governments, different pharmaceutical companies. We also want to make sure at the same time that we are following appropriate protocols and not cutting any corners. And a lot of work has been done into making sure that we pay attention to scientific details, not cut corners there, and at the same time accelerate other parts of the development process like distribution, storage, things like that. So I think practically speaking, I expect the vaccine to be available maybe beginning of next year, but a limited quantity of supply may be available even prior to that, depending on how the phase 2 and phase 3 clinical trial results pan out. There are some vaccines which are ahead in trials as compared to others. And of course, as we build up manufacturing, there might be some initial distribution of the vaccines which are ahead in clinical trials, and we'll obviously have to prioritize based on who's at highest risk, whether that's our elderly population, nursing home population, or healthcare workers and things like that, or people with underlying immunocompromising conditions. So those are the things that we'll have to decide moving forward, and that will be decided based on the data from the clinical trials that are going on right now.
Speaking of data, the CDC a few weeks ago released data that showed 94% of COVID deaths had underlying health conditions. So that information was somewhat misinterpreted maybe by some that suggested only 6% died of COVID while others had the underlying health conditions. Can you sort of explain this?
Yeah, so we should not discount comorbid conditions. I think they play a very important role in your developing complications from COVID. When you say that most people who died from COVID had underlying medical conditions, you have to pay attention to what kind of medical conditions we are talking about. These are not people who are on deathbeds from before. These are people who have common underlying medical conditions like diabetes, obesity, high blood pressure, cardiovascular disease, stroke, other less, or what we call as, or we commonly refer to as benign diseases like asthma, things like that. And some people have underlying lung diseases like COPD, or they may be taking medications to suppress their immune system for one reason or another, maybe for arthritis or cancer and whatnot. And if you look at all these comorbidities, these are very common comorbidities in our general population. So COVID is not just a disease of elderly. There have kids who have died from COVID. There are kids who have developed complications from COVID. And every now and then we see otherwise young, healthy individuals who get into complications. So it's I don't think we completely understand how COVID overwhelms your immune system or triggers something that that leads to a widespread immune response. So I think we cannot. I don't think we can dismiss COVID as a disease of elderly or very sick individuals. It's a disease that all of us are vulnerable to.
And of course, we talked to you in May, and now quite a few months later, we're having this same conversation, and we ask you this: what is the true death rate? Because assuming many people have had COVID and been asymptomatic, might not have been tested. So do we really have a solid number, or is it lower than first thought, or what?
So I think I did some calculations the last time I checked, and if you looked at nationally, the number was closer to 3%, and this includes, the number of cases that we say that we have nationally, includes the number of people we have tested as part of contact tracing, and they have been asymptomatic. So including everything, nationally our death rate stands at 3%. And if you look at the state of North Dakota in particular, our death rate stands at about 1%. So the truth is probably somewhere in between. So we could safely assume that the death rate is at least 2%. And this can be variable depending on what your denominator is. So if you talk about death rate, if you start showing symptoms of COVID, that's obviously going to be pretty high. But if you include everybody who has COVID, and that includes people who have asymptomatic infection and never develop any manifestation of the disease, then that death rate goes down a little bit. But even in North Dakota, where we have very high testing, our death rate still is closer to 1%. So I think the death rate is significantly higher than what we see with influenza and other common respiratory diseases.
Well, let's go back to a kind of a basic question maybe people would have liked earlier in the show. How and why does the virus spread? Many people say it's very contagious. Others say it's not that contagious. So
yeah. So again, depends on the situation. Most answers in science are not as straightforward. I wish I could give you a straightforward answer, but I will give you an answer. And it is a virus of indoors. Specifically, it is a virus that spreads, that's very contagious in large gatherings indoors. Those are the points to remember. So, and that's why we suggest a limit on number of people. That's why we suggest limited gatherings. That's why we suggest that try to move event outdoors if possible, or wear a mask when you are in a crowded place. So there are two things that make this virus very transmissible. Excuse me. One is the asymptomatic spread, which means that you may not know that you have the infection and you could spread the virus to other people. The other is the airborne spread. So what happens is in indoors where the air circulation might not be as robust as it is outdoors, or in otherwise closed spaces with not very good air circulation, the virus can linger in air for a very long period of time. And that leads to the second particular feature of this virus, which we call as super spreader events, where one person can transmit virus to a great number of people, 50 people, 100 people. So super spreader events is the technical term for that. And then in that cases, you have one person leading to an explosion of cases and multiple chains of transmissions at workplaces, households. So in a sense, in summary, what we see is a very rapid spread, very easy spread in large gatherings indoors.
Do you think America's longstanding trait of independence maybe has made it more difficult to get this under control?
That's a complicated question. I think the answer is yes, but I don't mean that in a bad sense. I think that's one of our strong points of the society here. We have fought, our ancestors have fought very bravely for these rights, for these basic human rights like freedom, and we continue to fight for these even in our generation. So I think these are principles that we hold very dear to us, and will fight for those. So complete lockdowns are very difficult to do when we hold those principles so close to our heart. So I think those are important principles for a society to uphold, and that's our strong suit. But it makes control of the virus or containment of the virus or complete elimination of the virus a little difficult too. So there's a price that we pay for our rights. I understand that. But at the same time, we have our individual responsibility too, of if we are having sick, to take care of people who may not do as well as we may do when we have the disease. So wearing a mask, I think I see that as our individual responsibility, and it should not be seen as a mandate. I think we should see it as our individual responsibility to our loved ones, our family, our friends who may not do as well, or our community members in general who may not do very well if they get COVID.
In terms of how people view the virus, why might the issue be falling along party lines?
I don't know if that's really true, or I think it's more complicated than that. What I see is people are now getting tired. This is a long drawn out fight. People feel the pain, not just see the pain, they feel the pain. Social isolation. CDC conducted a survey during the months of March to May. Many people who were in a lockdown, they suffered from high rates of depression, or the drug use increased. So social isolation has a pretty big human cost. And then add to that the economic loss that we are suffering. So many people have lost their jobs. Our unemployment rates are through the roof. So these are real issues that make people tired in the long run of the virus. So it's only natural for people to say that, look, I've had enough, we need to move on with our lives. And I don't think that falls along a party line. I understand, before we say where we are on the political spectrum, we are all human beings, and we have our own feelings about everything. And whenever there is socioeconomic misery piled onto that, people have a natural tendency to get tired. So I understand when people say that, look, this is not a big deal, we have to move forward. Well, we have to move forward, I agree, but we have to move forward taking individual responsibility for what we do. And there are certain compromises that we will continue to have to make till we have widespread availability of the vaccine.
Do you feel or find that most people trust the medical experts on this, about what they've heard? Obviously, the virus was so unknown at the beginning, and some things maybe weren't right, but so are people trusting the medical experts now?
Yeah, I think so. If you say, I personally, I would say that I see a lot of patients who have who say unprompted things like, "Doctor, how are you doing? I think about you a lot when I see the news." So just like we care about them, they care about us, and they come to you for advice, and they'll call you asking, "Listen, my mom has this kind of condition. Do you think it's safe for her to go to a grocery store?" The schools come to you and tell us that, "Listen, we understand that kids need to go to school, and it's very important for their development how we can open them safely." Businesses come to you and say that, "Can you help us make sure that we are following appropriate protocols so we can keep our employees safe and our customers safe. So I think I think the society still trusts the medical system. You know, we love being questioned, and you know we will be the first ones to admit that that we are wrong. Science is not perfect, and there are things that we suggest as a matter of opinion. And you know, at the same time, we need to be humble enough that that whenever we do research, we do trials, and our assumptions are proven wrong, then I think we should be able to say that yes, we were wrong, and let's not try this. Let's try this based on what evidence we have found in the clinical trials. So I think as long as we can do that, as long as we can have a perspective about ourselves and the ability to say that yes, we were wrong about that or we were right about that, I think people will continue to trust medical professionals.
What is bed space looking like in hospitals across our region right now?
So I think honestly, I would say that we are struggling a little bit. As you can see, our case numbers are high, and that's not the only reason. Again, this is what we call as multifactorial. Case numbers are high across the state, so the smaller hospitals are pretty much full, and we are taking a lot of patients here in Fargo in transfer from the western part of the state. And add to that that there was a lot of care that went on pause or that was on hold when we were in a lockdown. A lot of people were staying home and postponing their surgeries or appointments. So the hospital numbers are very high right now because we are catering to the missed opportunities for care previously, and at the same time we are seeing large community spread. So we can still take care of COVID patients. We are not overwhelmed, but we are pretty much working at our peak capacity right now.
At least in this country, looking back February or March, and not putting blame anywhere, just saying, what could we have done to make it more manageable?
Yeah, absolutely. You know, so confusion during initial part of the pandemic is not unheard of. It's kind of almost always expected, because whenever you have a new outbreak, it takes some time to for us to learn about it and do things in a better way. And the virus doesn't wait for anybody, and particularly the one that spreads very rapidly, like COVID does. So I think we could have, we can always learn, but we can always use that opportunity to make ourselves better prepared for the next pandemic, and you can be sure that there will be another one. So I think we have learned a lot. I think the most important lesson is better communication and coordination between different countries, different parts of the healthcare continuum, whether it's the federal government, FDA, CDC, FEMA, Department of Health, and individual healthcare systems like ours, and our nursing homes and our sister institutions. I think we all have kind of our individual emergency preparedness plan. I think that needs to gel together a little bit better across the entire healthcare continuum, rather than everybody making their own plans. And I think as long as we can do that, I think that would be a very good lesson that we would have learned from this pandemic, and we would be better prepared for the next one.
What do you think fall and winter is going to bring as cooler weather gets here and we start moving inside more?
Yeah. Confusion, unfortunately. And the reason for that is the weather that you call fall and winter, I call it the respiratory illness weather. And there are a lot of viruses, respiratory viruses, that circulate very widely throughout the community during winter months, be it influenza, be it RSV, be it enterovirus, and things like that. And all of them have these common features of respiratory symptoms: cough, cold, sore throat, headache, chills, fever, body aches, muscle aches. And it becomes very, very difficult to tell people what is coronavirus, what is influenza, what is RSV, what is just common cold. And that you know, in the years past, you would test for influenza, get a rapid test back, make a decision quickly on what to tell the patient, and move on. Here in the COVID age, you'll have to test for multiple different viruses, either influenza, coronavirus, RSV, things like that. And Not just that, then you have to decide what to do with the contacts, what to do with the classroom, what to do with the business. So unfortunately, there will be some interruptions while we take our time to figure out what kind of infection we are seeing in a particular group, whether it be a classroom, whether it be a dorm, whether it be a local business.
Well, unfortunately, we're running out of time here. So if people want more information, where can they go?
Call your provider, see, they may be able to direct you to the best source. They know your individual history best, and they are your best source of information. But if you're looking for general answers, CDC is a pretty good website. Department of Health maintains a pretty good website. So those are resources that anybody can use. And of course, you in traditional media outlets have done a fantastic job of conveying facts to the people. So always confirm what you're hearing on your social media feeds with proper authorities.
Okay. Dr. Nagapal, thanks for joining us today.
Thank you very much.
Well, that's all we have on Prairie Pulse this week. And as always, thanks for watching.
Funded by the members of Prairie Public.